Thanks, Emily, and good evening, everyone. Thank you for joining us, and it is my pleasure to introduce Dr. Diana Hernandez with Columbia University. Dr. Hernandez is an expert in the intersection of housing, energy, health, and equity, paying particular attention to the health impacts of structural changes in built environments. I took a couple notes when I was reading about Dr. Hernandez. Her public health focus is looking at that intersectionality of poverty and health outcomes as it pertains to energy and housing and income. She studies how structural changes, improvements to the environment are associated with the outcomes of lower income folks. And she's very keen on data translation and translating all of the excellent findings into action, which is essential, especially these days. And I especially loved what I read about you, your value of innovation, paying particular attention to mentoring young people and students, encouraging people to think big, imagining a world without limits, and inspiring students to be bold, take risks, and especially to persevere in the face of challenges or in their pursuits of knowledge. And then finally, that emphasis on service. And I really appreciated what I read about you, and because right now in this climate, it is especially important to think innovatively and outside of what we think is possible, I think. So with that, I'm going to turn it over to Dr. Hernandez, and thanks again, and I'm looking forward to hearing what you have to say.
Thank you so much, Suzanne, for that really generous introduction and for taking interest in things that are out there in the world about me. And Deborah also for the initial invitation, and Emily for all of your efforts in coordinating this. So I will share my screen and start with kind of an introduction, a little bit of a caveat in saying that, and I mentioned this to Deborah and company at the outset, my talk is very much rooted in the kind of issue of energy insecurity. And there are climate kind of connections, but there are other connections that I hope you all will make, and I invite conversation about that. And actually, yesterday, I thought that this was happening yesterday, and so the date is wrong because it was my mistake. Let me just ground this work in a place that is very familiar and is home to me, my family, for generations, the Bronx. So last year, last January, there was a pretty deadly fire in the Bronx that made national headlines. 17 people died, 8 of them children, in an affordable housing building in the Bronx. And the real cause of the fire was a faulty space heater. And that faulty space heater was running incessantly. And the family relied on a space heater for supplemental heat because whatever was happening in the building kind of led them to having to cope in this way. The headline and the kind of takeaway from this story from a policy perspective was, you know, we have to fix the doors that malfunctioned because they didn't self-close. But if we looked further, the real cause of this was the fact that in places like the Bronx, this building being kind of an example, what we really have are detrimental and problematic, underinvested in housing and heating infrastructure and energy infrastructure more broadly. And in this op-ed in the local paper, I basically wrote about the need for improving housing conditions and access to comfort and dignity in people's homes. Today I'm going to introduce the concept of energy insecurity, talk about the populations that are disproportionately impacted by energy insecurity, talk about access to air conditioning, which is really critical for a warming climate, and then also talk about the lived experience of energy insecurity in New York City. So energy insecurity is really is defined as the inability to adequately meet basic household energy needs. Some of us started to kind of gain awareness about this issue, definitely in the US, kind of from a policy perspective, during the oil crisis of the 1970s and 80s. And there were many programs that were introduced as a result of that kind of sudden shock in energy prices and availability. But we've kind of understood energy security as kind of a national threat or a national security concern. But there are also ways in which households can be insecure. And so the way that I define energy insecurity is as in parallel to food insecurity. So in the public health world, we acknowledge that people have challenges in meeting their food needs, not just from a provisional standpoint in terms of the amount of food, but also the quality. And so energy insecurity also is about affordability and quality. There are three dimensions to energy insecurity. One is an economic dimension, which really is reflected in this kind of ratio of high bills to low income, where if people have kind of excess cost relative to their income, then it forms and serves as a hardship. There are also physical aspects to this, and that's really reflected in inefficiencies, in faulty home energy infrastructure, and dated appliances. And it's very possible to have one but not the other of these dimensions. So it's possible to have a physical dimension of energy insecurity and not be burdened financially, maybe because you have a high enough income, or maybe because if you're a public housing resident, for instance, you have a utility allowance, and that means that you don't necessarily have a utility bill, but you still might be encountering some of the physical aspects of energy insecurity. And then there are behavioral or kind of coping and adaptive strategies that people use, oftentimes at the intersection or to respond to or prevent these kind of economic and physical dimensions of energy insecurity. And it's important that kind of behavioral or kind of coping dimension, because that's where we acknowledge people's agency and the fact that they are managing kind of suboptimal circumstances in an effort to make do. Another way to think about energy insecurity is in terms of how it's not just severity, but how chronic or acute its presence is. So power outages, for instance, are a good example of an acute energy insecurity crisis. And it really doesn't reach kind of chronic, for the most part in the US, at least, power outages don't reach a point of kind of chronic, it doesn't, kind of stay on a chronic basis, except if you were in Puerto Rico following Hurricane Maria and Irma, in which case there were people without power for months on end. The chronic nature of energy insecurity is really about the staying power of these economic and physical challenges, and the fact that for some people, it continues throughout the year and it continues year after year in kind of a little bit of an unchanged or worsening state. So this is another way of thinking about the kind of interconnections of energy insecurity. So these energy financial kind of components, and there's the burdens and also the buffers. So the safety nets, for instance, help to buffer against energy burdens, financial burdens, but sometimes there are challenges in people accessing those financial supports. Then there's energy access. And again, that's kind of the example of a power outage or a shutoff. I'll talk a little bit about what that looks like, and the adequacy of heating and cooling, the availability and adequacy of heating and cooling systems. There's the coping and behavioral strategies, the just transition or an energy transition that is unfolding. And there are some mechanisms to help it be more just, like federal programs like Justice 40 or the Inflation Reduction Act that kind of have extra supports and mandates around the distribution of funding to disadvantaged communities. But this energy transition is unfolding with decarbonization and electrification as kind of the endpoints. That means that there is also the chance that the most vulnerable populations will essentially be left behind, or at least have a lot to catch up on as others accelerate and are earlier adopters. These housing conditions, which I described before, as well as the climate threats. And those climate threats, one of the most proximal ways in which people might feel extreme weather events is actually through the power grid. So that extreme weather, storms, hurricanes, excess heat and cold compromise the availability of household energy. So I want to talk about a few people that I've met over the years. This is a gentleman that I met in the Bronx. And he talked about, he was a renter, a young man in his first apartment, really excited to live alone, and, was basically working, but unstably. So there were times when he was employed, there were times when he lapsed employment. And so that meant that his income was also unstable. When I met him, he had an arrearage of about $1,200 and was at risk of a disconnection. And he had already lived through a disconnection and knew how uncomfortable that was. But he also described other elements of the hardship of being energy insecure. And he said, I have to put on my oven at night because of the heat. The building controls the heat. The heat comes on only a little bit. It's almost like you don't feel anything. It's like freezing cold and I have to turn on my oven. Even though I know the oven is not a good thing to turn on, I turn it on at night, like every night, and that's why my bill is so high. But it wasn't just his bill that was high, as he was supplementing the heat that should have been included in the rent and should have, by kind of New York City guidelines, been at a certain level of comfort. It also meant that he was waking up over the course of the night because he would feel anxious, and he would also he would feel nauseous, but he would also feel anxious about the safety concerns in keeping his oven on. So he says, when I get up, I feel nauseous. I know they say carbon monoxide. When I wake up, I feel like I'm suffocating. Then I shut it off and I deal with the cold for another 4 hours or so. And many of us have been paying attention to the whole gas stove issue and how, just from regular uses like cooking, there are increased exposures to toxins in the home. Imagine what that looks like if your oven is on for hours on end, wide open, and what that looks like in poorly ventilated spaces, right? So we often think about the gas stove issue as very pronounced for kind of, and many of us are affected by the gas stove issue, but it's especially pronounced if you're using the stove for these other reasons. And basically, from a health impacts perspective, he says, I just feel depressed. And he says, oh boy, here we go again, another turnoff notice. He says he gets a little down and anxious about how he's going to pay for it. And then this is Sophia, and she's a woman also that I met in the Bronx. And this is not a full Bronx story, but I'm using New York City as as a home base. And so I hope you are okay with that. But so this is Rosalina. I met her at the low-income home energy assistance program offices in the Bronx. She is a retiree and a pensioner. Her home runs on oil and electricity. She's a homeowner. And when I met her, I also met her daughter. And basically she summarized her circumstances in 2 words. She said, Diana, I suffer. She suffers because she can't put her thermostat at a level where she feels comfortable, because she's extremely concerned about the affordability. And her daughter really talked to us also about the question of having to decide between the basic expenses around, her medical needs or her energy, and kind of needing to prioritize. And because that year when we met, she happened to be in good health. She was able to focus on her energy bills, but sometimes the energy bills take a back seat when she has to prioritize her medical bills. So this is really the kind of tension, what they call the heat or eat or heat or treat dilemmas that people are experiencing as they try and manage their bills. So from a population perspective, what we're really looking at is that there are kind of significant inequalities in who experiences energy insecurity and how they experience it. And this is data from the Energy Information Administration. They administer the Residential Energy Consumption Survey every 4 to 5 years. So they've been tracking the issue of energy insecurity, really firstly among recipients of energy assistance services, and then more recently, as of the 2015 wave, population-wide. And what they found is that somewhere around that 30% mark of households are experiencing energy insecurity. And that number dipped just a little bit during the pandemic. As you can see, their latest wave was conducted in 2020 when there were moratoria on shutoffs. And so people were less likely to receive a disconnection notice. And you can see that shift between 2015 and 2020. But many households are experiencing or at least one indicator of energy insecurity that is used by this source is reducing or foregoing basic necessities to pay the energy bill. And you can see that's a pretty consistent issue, as is keeping the home at an unhealthy temperature. And if you look at the color bars, for some households, that's happening almost every month, or some months in the darker colors, or 1 or 2 months. But you can see it's a chronic issue for a lot of households over the course of the year. And in thinking about the kind of sociodemographic distribution and patterning, we see that the kind of populations that are known to be either vulnerable socioeconomically or the subjects of structural racism kind of continue to be more heavily burdened by energy insecurity. So, there the kind of question of Latino households, Black households, mixed race households, all being kind of disproportionately impacted, lower income groups as well, renters, households with children, and then households in the South. There's kind of a pretty not even distribution, but close enough across the regions. But in the South, where cooling hardships or cooling issues present themselves more frequently, we see that there's a little bit of a higher prevalence of energy insecurity in that region. I want to get back to this question of households with children, because a lot of the kind of state, or at least the imagination of people when they think about who might be impacted by energy insecurity often goes to the aged. And that makes a lot of sense because they're extremely vulnerable. They spend a lot of time at home. They might might be more likely to, like, essentially die of hypothermia or hyperthermia at home. But from the perspective of these kind of more chronic examples of energy insecurity, it's actually households with children that are disproportionately impacted. And again, we see that the elderly, then that's not demonstrated here, but it is part of some analyses that we've done to show that the elderly are not as impacted, which to me, is a reflection of the fact that there's more wealth in older age, and that people might not have as many competing expenses as they age, compared to households with children that have childcare expenses, clothing, and other things that they have to tend to. So there's a racial gap in residential energy expenditures, and this has been described in a lot of the literature around energy burden. We have a forthcoming paper also showing that there are rate differences between areas or utility service territories that serve predominantly BIPOC populations in comparison to those that have a smaller proportion of BIPOC customers. So definitely there's a growing awareness of the fact that there's this kind of the racial disparities. And in a paper that we published in 2020, we call out a few reasons why that might be the case. So racial residential segregation, housing burdens, people paying disproportionate amounts of their income toward housing, that they also pay a disproportionate amount of their income toward energy, that there are bundled hardships, so that they're more food insecure, housing insecure, and present with other medical vulnerabilities that might also be drawing down not only on their income, but on their income potential. Health disparities, likewise. So health is both kind of a predictor and an outcome of energy insecurity. Extreme weather and climate impacts. Of course, there are some like kind of various examples, but Katrina comes to mind, as does Puerto Rico, which I noted before. But the idea that there are some areas that are not only more impacted, but that they have less hardened infrastructure to support and be resilient through those extreme weather events. The depletion of the resilience reserve, which is really a concept around what people are able to manage, right? So if you have these bundled hardships, lots of trade-offs, eventually, if you think about, resilience as existing in a piggy bank, and you're constantly drawing on that piggy bank for regular day-to-day things, it makes it a lot more challenging to deal with these kind of acute instances of energy insecurity. And we think that there's a link to that and race, the energy transition question, and then gentrification and displacement and the threat thereof, all really kind of playing into this issue around the living situations, the financial situations, the housing situations that people of color are more likely to encounter. So I'm going to show 3 examples of how energy insecure, how the people in the US are energy insecure, and talk about these energy cost burdens, discomfort, thermal discomfort, and disconnections. So this is a map of the US, obviously, and showing the burdens where low-income energy burden levels. And as you can see, as I kind of noted before, in the South, there's a heavy concentration of higher levels of burden, but also in the Midwest and in the Northeast, especially in Maine, and I guess New Hampshire is kind of in the darker blue too. And that has a lot to do with poverty levels in these areas, as well as the costs of energy. And Deborah, I know earlier you were talking about how that's rising. And so this is from 2018. So these levels can be even worse now if we were to track it more recently. But thinking about that kind of disparity between low-income households and higher-income households, low-income households pay 7.2% of household income toward utilities, and that's more than 3 times the amount that higher-income households pay. And greater efficiency can help to reduce energy burden by 35% for low-income households, 42% for African-American households, and 68% for Hispanic households, really showing that there's an opportunity to do more in terms of improving the energy efficiency of homes and thereby reducing energy costs. In New York City, that actually is also really maps on in terms of like which neighborhoods are most socioeconomically disadvantaged. So in the darkest colors are kind of the lower income areas of Queens, of Brooklyn, of the Bronx, and the lighter colors are the kind of wealthier areas in Manhattan and in Brooklyn and Queens. So what we really see here is that energy cost burdens are most concentrated where families are earning 200% or less of the federal poverty level. And as I stated before, this is kind of a multi-dimensional problem. And so it's not just what people are spending, but also like the state of their housing conditions. And here we see, again, in New York City, that the places that are least likely to have access to a healthy home are, again, in those places in Queens, the lower income areas of Brooklyn. I'm sorry, opposite. So lower income areas of Brooklyn and Queens and the Bronx and Upper Manhattan, these are the least likely to have access to a healthy home and a home without defects. And in higher income areas in Manhattan, in more residential places like Staten Island and the residential areas of Queens and Brooklyn, they have more access to healthy homes. When one indicator of comfort is, at least tracking this from a New York City perspective, is looking at no heat complaints. And New York City has been tracking this over several years to see kind of, to actually, ensure compliance with the heating laws. And also with the data being publicly available, we can see kind of where people are most impacted by these no heat complaints. And as you can see, it's mostly the Bronx and Brooklyn. And kind of breaking it out a little further, what you really see is that the Bronx is overrepresented in terms of no heat complaints in the past few years, especially. And there are certain neighborhoods in these communities that really demonstrate this. And the reference to the Bronx is freezing, is that at some point people used to talk about the Bronx as burning, but in fact, there really isn't access to heat. There's the question of who has access to air conditioning, and that's least available, again, in some of those same neighborhoods. And the reason why I am emphasizing this is that as we think about these issues, right? So as we think about energy cost burdens, as we think about access to healthy homes and efficient homes and homes that are well equipped with adequate heating and cooling, what we see is that there are these kind of spatial, residential, population level disparities that we should be paying attention to in some ways to help us to target our interventions. And then from a clinical perspective and from a practical perspective, to really think about ways in which you can ask the question if you know that you're working with a population that is more inclined to be energy insecure. So let's talk about disconnection. So first of all, disconnections are practice of utility companies, often in an effort to recover costs. And that is, because of deferred payments, non-payments on the part of customers, and an accrual of debt. And that ultimately means that there are households that are penalized because they can't pay their utility bills, and they're basically denied access to energy services at home. And the data on this is pretty limited in some ways because the utility companies are not mandated to make this data public. There are many reasons why they might not want to share that information. And because investor-owned utilities are regulated by state public service or utility commissions, but are still subject to the terms of their that are required essentially by those PUCs or PSCs. It's not always the data to be able to show the prevalence at the national level isn't always available. So this is an analysis that we did using that residential energy consumption survey. These are results from 2015. We've since updated them for a forthcoming book that I'll talk about. But here we show that 3%, this is work done with Jennifer Laird, who is a colleague here at CUNY Lehman College. But basically what we see is that households are 3% of households in the US are experiencing a disconnection. 15% of them are experiencing a disconnection notice. This is kind of most heavily represented among low-income groups, among Hispanics, and especially Blacks. That lowest income household, those that have the lowest level of education in terms of a high school diploma or less, people with children, sorry, the left side of the screen is a little bit difficult to make sense of, but people living in mobile homes are much more likely, those that are reporting inadequate insulation, people living in older homes, renters again, and people living in the Northeast and the South are more likely to have to experience disconnections. And what we found is that as we kind of look at people who are at different levels of risk when it comes to disconnections, they're coping in different ways. So people that haven't received a notice at all, and are otherwise, like kind of secure from this energy insecurity perspective, 81.5% of them are not coping in any measurable way. But as the threat of disconnection increases, so with a disconnection notice and or having experienced a disconnection, far fewer people are doing less and many more people are doing more and a lot more. So many more of them are foregoing basic necessities like food and medicine. They're seeking energy assistance. They're keeping their homes at an unhealthy temperature and then doing kind of combinations thereof. By the time people have actually experienced a disconnection, many of them, 13.1% of them are doing all three, and many of them, the majority, so over 84% are actually doing some combination of coping. Really showing that, that kind of the agency part, but also the response to these kind of crises that are driven by greed in many ways and by a profit motive for such a basic thing. So I'm actually going to end the talk here because I'd like to invite some more engagement But I've presented a lot of different aspects of energy insecurity and its links to disparities and other things. But I want to invite us to also think about all of the ways in which health is implicated, as a function of both chronic and acute forms of energy insecurity. And in following this pathway, you'll see that, ultimately these kind of primary outcomes are unaffordable energy bills, impaired energy access, and indoor temperatures, kind of ultimately leading to a battery of health consequences related to mental health and psychosocial stress, poor sleep quality, heat and cold stress, arthritic and mobility issues, allergies and dermatological issues, suppressed immune function, pulmonary, respiratory, and cardiovascular diseases, and excess mortality during peak seasons of winter and summer. And so climate change and health are kind of factors that affect this whole system. And they can kind of, present themselves on either side of this, right? So these kind of acute energy insecurity examples are very much rooted in climate change, but it can also be an exacerbant of something that's already kind of very a form of hardship that people face. And so with that, I'd like to kind of invite opportunity to talk about these issues, also talk about them more locally, where you are in New Hampshire, see where there are kind of where this work might apply. And also the clinical perspective. I didn't mention this, but I learned what I know about energy insecurity in Dorchester, Massachusetts. Because there I was doing a dissertation project on the links between housing and health and how medical legal partnerships, so providing legal services within clinical settings, could help to mitigate the relationship between poor housing and poor health by improving housing and housing conditions. And it was in, connecting with people where they live and in their homes that I started to realize that the issue of household energy was a pretty ubiquitous problem. And it was nuanced enough, but not really captured in the literature. And so my work has really been about trying to expose this as a social and environmental determinant of health, and also to appreciate the fact that lower income groups face many challenges in trying to live kind of thermally comfortable, affordable, and dignified lives when it comes to energy. So with that, I'm going to stop my share and again, invite the opportunity to chat with people.
Thank you so much. I am unsure if you saw the chat. Maybe we could start there. There are a couple folks, I think Kevin, I don't know if you'd like to unmute and talk a little bit about what you mentioned in the chat, or if anybody else would like to unmute and ask Dr. Hernandez a question or make a comment. I'm actually
Kevin,
not.
do you want to ask the question?
Well, no, I just made a comment that, it seems like that those are associated. Maybe the term is energy apartheid. Food apartheid is a more appropriate term, than a food desert. It's like these are people who don't really have access to energy. In a nutshell, they're reliant on, they're vulnerable. I guess that's my point.
Mm-hmm. Yeah, I think the cumulative burden issue, right? So that environmental exposures come in different ways. And we've appreciated the environmental exposures related to air pollution and indoor air quality, outdoor kind of or ambient air quality and temperature and things like that. But we haven't really paid attention to some of these other dimensions of the kind of environmental exposures and even and very specifically, kind of connected to energy, especially in the US, we have made connections in the global South as it relates to clean cooking, for instance, and whether or not people are, burning biomass fuels to prepare food. But we haven't really fully appreciated how people, again, are turning on their ovens to keep warm, or burning things indoors because they can't afford their utility bills. Like these are risks. They're more hidden and less obvious in the US, but definitely, this is an invitation for other people to also start to study this a bit more and understand what that risk profile looks like and make connections that haven't necessarily been made before, including in thinking about energy as a particular source of environmental pollution.
And potential injury, when you think of exposure to toxins, particulates in the air, as was mentioned, and those multiple determinants, including the economic determinants that you've been talking about. Samara, hi Samara, put a couple thoughts in the chat, and Samara, I'm not sure if you're in a place where you can unmute and share, or if you'd like me to read them.
Oh, thanks. It's so good to see you, Suzanne. I'm back from my travels, for those of you who know. But anyway, I will just read one of my comments. I think the one was already made the point about burning things indoors, which can also exacerbate respiratory conditions. But I know that maybe one piece of encouraging news is that the CDC is currently doing a revision of its Building Resilience Against Climate Effects, or BRACE framework, and I'm serving on that panel. And we are really using the term energy justice now and trying to bring more attention to the equity-related aspects of that framework, so that every grantee who's using BRACE, or people who are just using it in different contexts, will have to pay more attention to this issue.
There's a request, Dr. Hernandez, could you speak a bit more to what potential solutions to some of these issues could be?
Yeah, I mean, I think that, let me just pull up one slide, and usually this is kind of where I end. But it's about a few thyou all at once, because we sometimes like those silver bullets, which are like, let's just go there. But if you ask me to put my money on anything, I would basically say that we need to improve housing, and we need to improve the housing conditions where people live, but also improving economic security, thinking about pathways for more affordable housing and more affordable energy, decarbonization, energy efficiency, weatherization, improve building codes, especially in existing homes and in naturally occurring affordable housing communities, and like kind of that more targeted approach at the community level, I think is really important. And also increasing energy literacy. And that focus is not just on people that are impacted by energy insecurity issues, but also, I think, and even more importantly, are the people for whom the costs are not a consideration. Because in fact, we have so much to learn from people that are on the front lines of this issue, in terms of energy conservation, and reducing a carbon footprint on the basis of like not using as much energy and not more than you need, et cetera. But energy literacy, I think, should be a goal for us in general, because those of us that are not kind of economically burdened are a big part of the problem. And so I think we also have to be a better part of the solution.
Yes, I was thinking about this when you, at the beginning of your talk, when you were talking about air conditioning and a lack of access to cooling and extreme heat, yet, air conditioning fans and oftentimes heating, it's counter to addressing climate change. And so how do we mitigate, the effects of climate change as we're, thinking about infrastructure, green infrastructure, and how does that, when you're looking at like older housing and things like that. And it looks like
it's a balancing act, it's like, we can't have people that don't have access to cooling, right? Because we are living in a warming environment. Of course, air conditioning kind of creates a feedback loop back into the problem. But then that is exactly why those of us that are not in that same position ought to be doing more to conserve and to be conscious of this so that there's enough space and room for others to be able to like achieve the comfort that they need to stay alive.
So we'll start with Semra and then we'll go to Deborah. Thanks.
Deborah, do you want to go first? Because you haven't had a chance, and I'll go after you.
Oh, okay, that sounds fine. Hi, Semra, welcome back. I know Semra's in New Zealand, and I lived there for a little while and encountered a lot of problems there because they have extremely bad insulation in homes all across New Zealand. So we spent $800 a month on a small home trying to keep it warm in the winter, even though it wasn't that cold outside. So that's an unrelated comment, but I guess I had a question. I don't know if you'll have a comment about this, but a lot of people think that a carbon cash back plan or a carbon fee is the way to go for doing something about climate change. And I'm just wondering if you have any thoughts about how that might impact people who are suffering from energy insecurity.
Well, I mean, I think it should be that fee should be assessed to people who are using more energy and can afford to pay more and not conserve, right? I don't think that, I think, you know, we should maybe set limits in terms of who is included in that fee structure and who's excluded. But definitely one of the biggest challenges that we have in the energy space is that the ways in which rates and fees are assessed are not commensurate at all with whether or not, like, the ability to pay. And that's different than housing. It's different than food. It's different than other commodities that really do have some kind of market variability. Energy doesn't have that. And so we're also on top of that assessing these kind of fees in an indiscriminate way. We'll just create a regressive system and situation where people that aren't able to afford it and are really doing a lot to conserve actually out of necessity are then kind of hit with more. So I really do think that this is an instance where households and other entities that can should be assessed accordingly, and their rates should be higher too. There's really no reason why a low-income household should pay 3 times the amount of their income compared to a low-income household, right? Like, like it just doesn't, non-low-income household rather, it just doesn't make any sense. So, Sam.
Yeah, thanks. I love the focus on energy literacy. And I wanted to point out that I think one thing that really would be relevant for both the clinical folks and the public health folks on the call is we often look at things like the community health needs assessments that communities have to do under the ACA for hospitals as a way of prioritizing what needs are. And rarely, at least in New Hampshire, does climate change come up explicitly. But always, always these needs around housing and access to safe housing and transportation, those things come up, and we just, it's almost become a political strategy to downplay the importance of climate change because we haven't done a very good job of articulating the very connections that you made, Dr. Hernandez, that it's, these linkages and those disparate burdens that are really at play. So I really thank you for highlighting that for us.
Thank you for even, discussing that, the issue of these health impact assessments and health needs assessments. One of the first prevalent studies of energy insecurity that I did in the US was actually tied to that. So my home institution, obviously, is Columbia, and it's part of New York Presbyterian, and a group of us were asked to come up with surveys for the community health needs assessment tied to ACA. And we included a battery of questions related to energy insecurity. And it was the first time that it had been done at the community scale. And we found that 27% of Washington Heights residents were energy insecure. and that if the people that were the households that were most impacted were the long-term residents. So it wasn't the new, like gentrifiers, if you will, in Washington Heights. It was the people that had been living there for 10 years or more, and many of them for even longer periods of time. And we also made connections to various health conditions. The most obvious were around sleep quality, around mental health, and also, I forget what was I have the other one, and respiratory illness. So, and those are not surprising, but we finally had the data because we were able to leverage this existing kind of mechanism. And so, I think, Semra, to your point, we should be using those as opportunities to like broaden the scope of interest and understanding of our local communities.
Thank you so much.
We have about 5 minutes left. Is that correct, Emily? We go till 7?
Yes, we go till 7.
Yes. Okay, thank you. And just wanting to check the chat. Couple more thoughts. Kevin says, in my community, Springfield, Illinois, the needs assessment correlate with the location to coal-fired plant. Yes, and then thinking, and we have, Dr. Hernandez, something I forgot to mention at the beginning when I was introducing you was your book release that's coming out. And I wonder if you'd like to spend the last few minutes talking a little bit about what you're about to launch in your book.
Yeah, thank you. So this labor of love, I had a baby in 2021, but giving birth to this book has been like
2 labors of love.
Oh my goodness. But I think one is much harder than the other. Anyway. So the book that I'm writing is Energy Insecurity, the People's Struggle for Power in America. And it basically uses the residential energy consumption survey, an original survey of mine that I did, and then in-depth interviews to really tell the story of the kind of primary dimensions of energy insecurity, the crisis points, and the health and social consequences, as well as a policy roadmap to think about, well, what do we do around the kind of energy insecurity questions, and how do we create more energy secure communities and populations and households? And so it's kind of a first treatment on this, and a book length, especially focused on the US. And so it's based in narratives, and then has these kind of more statistical complements to really show the story from the personal perspective and also from the numeric perspective. So happy to share the information when it comes out. It should be out later this year.
That's amazing, and congratulations on both of your labors of love. And that's quite a lot, to have a wee person and in your life, and do a lot of writing. And this was just very inspiring. And I want to go back to that, the importance of science and these new discoveries in translating to action. And, for public health, it's something that we still need to get a lot better at, and shortening the time between these new findings that we're making and policies in action that improve equity and the health of the people in our communities. And I think we're about 2 minutes. I'm going to turn it back over to Emily and see if there's any last housekeeping or anything that needs to be said.
Yeah, thank you so much, Suzanne. So I will follow up with everyone tomorrow with the recording to this webinar, as well as some of this information in the chat, including this link and the information about Dr. Hernandez's book. So that will all come to you tomorrow. And just a big thank you again to everyone for coming. Thank you, Suzanne, for moderating tonight. That was wonderful. And thank you so much, Dr. Hernandez. That was really, really inspiring. And I hope you don't mind if folks have follow-up questions. I might give them your email address to contact you, and we can look forward to staying in touch.
Absolutely, absolutely. Really, thank you so much for listening, for engaging, and for your interest and commitment to this. Obviously you all are here because you care, and the